I want to give you some insider tips. If you have an older loved one in the hospital, I want you to ask 2 questions. Every time a test is ordered, I want you to find out why and what are we going to do with the results that we get. For Daniel, 7 different tests were done with the justification that he had mental status changes. So that meant that he was taken out of the comfort of his bed, he was put on a hard gurney, rolled through the hospital corridors, on and off of elevators, down to the radiology department, to the waiting area for his turn to have chest x-ray, MRI, CAT scan, whatever it was. 8 different times over the course of 2 weeks at least. That's what happened. So you want to know why. Why are we doing those tests? In Daniel's situation, they would say, well, he has these mental status changes. We need to find out why this is happening. Okay, but if we read his chart, we see he has advanced dementia. So an expected progression of that is mental status changes and decline. Also, Daniel has a bleeding disorder. He was chronically anemic and he had lost some blood prior to coming in. Another explanation for why you might have mental status changes. So if we have a reasonable understanding as to why these symptoms are happening, why are we continuing to test? Why do we continue to seek answers to questions that we don't need to be asking? So the other part of that you want to keep in mind if you have an older loved one in the hospital and they're having testing is to say, what will we do with the results that we receive? Because if you're doing testing, it's to get answers that will chart a course of treatment, right? That's what makes sense. We don't just do testing for testing's sake. So in Daniel's situation, someone would have explained, well, we need to find out, is he bleeding in his brain? Because he has these low platelets. Or perhaps he has a tumor. Or maybe he's had a stroke. And that will explain these mental status changes. And family, when they hear that, generally says, oh my goodness, yes, we should find that out. That sounds awful. But then you have to ask, okay, but then what? If we find out one of those things happened, would anyone recommend that a 90-year-old who has advanced dementia, who has non-Hodgkin's lymphoma, and a bleeding disorder have brain surgery? I would certainly hope not. And so why are we doing this? Why are we disrupting his comfort and compromising his well-being by doing all of this testing?